Welcome to the Sunday Symposium on April 19th. Our speaker today is Mary Foley, who is a clinical professor at UCSF School of Nursing, who's going to focus a little bit on infectious diseases. Mary, you're on.
Thank you very much. Thank you to my friends and colleagues in Oakmont, those of you I've known and those I'm getting to know. And I appreciate this opportunity to be with you in this format. It is our new normal to interact and meet and have conversations remotely. So this feels kind of comfortable. I'm doing this all day with students and faculty and others around the country as we cope with all the new safety features. So I really appreciate your openness to a little bit of a presentation about Florence Nightingale as a registered nurse for 47 years. I'm really proud of the profession I chose, or maybe it chose me. And this is an interesting time, and I'll show you why it's quite a coincidence in a way that there's so much focus right now on nursing and doctors and respiratory therapists, all those other wonderful frontline people. And much of what we're doing now in terms of our staying at home and working on hygiene is exactly where Florence Nightingale started. So I think this is timely, and I really appreciate the opportunity to tell you a little bit about why this is a celebration of her life this year as organized through the World Health Organization. So she is given the credit as being the founder of what we call modern nursing. There's no question that there were individuals in the Crusades, for example, or people who were cared for, generally the poor, who were cared for by individuals who served their needs, but there was no organized structural didactic or program known as nursing until after Florence Nightingale had her hands in it. And I'll tell you how she got there. So Notes on Nursing is a classic document that she provided. She was an incredible, prolific writer, also a statistician and a public health expert. She really became quite an important person in the city of London, in the country of England, and then globally. She is the founder of modern nursing. She came from a very wealthy family. There was no plan for her as a Victorian woman to get involved with the humanity of people in need. And it was not in her family's vision of what she would do that she would find her way in this on this path. But before she was asked by a friend of the family to help the War Department, she self-studied. She knew that there was a calling. She felt that she had a passion and a mission to serve, and they were very religious. And she pursued information about the care of others, what we'll call nursing with the small n. She actually went to Germany, to Kaiserwerth, studied with the deaconess nuns there, who cared for people in institutions, usually again either the dying or the very poor. And so she became inspired to return to England and put some of what she'd learned into practice. She did work in a religious facility for a while, bringing some nursing care to the individuals there, again usually dying or very poor individuals. And then a family friend got in touch with her because they had heard that she had developed some skill sets and some knowledge, and asked if she would help out during the Crimea War. There was a terrible death rate occurring in the injured in the Crimea War. It's in Turkey. And as it turns out, these were not individuals, these soldiers were not being killed in battle, they were dying after battle. As a result of the really poor conditions in which they were cared. And so she really instituted, let me go to, this is one of my favorite, couple sets of slides, kind of geeky, but because she was a statistician, she hand drew these charts. And now we have computer programs that create these phenomenal statistical maps, but this was done by her because she wanted to demonstrate the difference in mortality from before and after she was there. She must have had some insight that if you want to convince others that you're making important changes, you should document them, and that data speaks loudly. And sure enough, it did. And it really just helped show that after a peak death rate, 43% of cases of soldiers who were injured would die subsequently um, of the conditions in which they were being treated. She brought that mortality rate down to 2%. And that was done in about 6 months. So what did she have at her disposal? No antibiotics. This was before the germ theory, which was kind of created and launched in 1860s by Louis Pasteur. But she had picked up a lot of information in her work in Germany and watching how the nuns gave care. And what she did, this is a saying that we use a lot in patient safety, to remind us that we're not supposed to make people more ill, that we're supposed to make them more well. And she brought funds, so she was well funded, and she had a following. Dickens had written about her, and so she had a bit of a notoriety in England. She was able to get money from enlisted soldiers and the wealthy from London. And she instituted and established standards of care, basic necessities, clean clothing, dressings, bathing, and adequate food. And this all became quite well recorded. She became world renowned eventually. Queen Victoria awarded her a special award, the Nightingale Fund, when she returned to London. And with that money, she actually created the first school of nursing. This is an example. This is the hospital ward in Scutari after Florence Nightingale had her influence. And if you notice, there is distancing. Think of our message right now about social distancing. The windows are open, there's fresh air, and there's sunlight. And fresh air and sunlight are two of the best disinfectants we know. And so this is just a kind of a classic illustration, proof positive that very basic common sense strategies initiated at that time turned the corner on what was traditional care in hospitals. And it gave Florence Nightingale the foothold that she needed to really return to her home of origin, to the London area. And I'm going to just mention again, I'm just going back a little bit, that she became an expert on the issues of public health. She became passionate about the issues of tuberculosis in the tenements of London and the lack of clean air and clean water in that city. She was very concerned about the environment. She continued to use data. She continued to write and do her statistics. And she was one of the first women ever to be recognized by the royal body that recognizes statisticians. She was very patient-centric. She said, you know, let's focus on the soldiers. She took food and supplies away from the officers and redirected them. She started the first formal school of nursing. And she actually was one of the first individuals to demonstrate that care and passion for soldiers. And you think of the Veterans Administration now, this has been a long-standing and long-lasting. Many nurses have served in the Army, Navy, Nurse Corps, for examples. So there's someone who's written a book, and they called Florence Nightingale the mother of all hospital administrators. And so I can only imagine, you know, that she had her way, and she probably had quite a forceful way of sharing her ideas, but it seemed to work. And this is kind of the foundation of where I wanted to start us today, with what we knew about someone who did not have any meds, any IVs, any ventilators, you know, really didn't have the equipment on hand that we're talking about almost on a daily basis in our personal lives right now. So where have we been? So here's germ theory, came in, you know, almost 10 years after Florence Nightingale's experience in the war. Open the windows, give clean bedding. She took soldiers at that time were bedded more than one soldier to a cot. So you can imagine how, you know, that might have been detrimental to healing and well-being. And so these were just basic principles. That's why 2020 was declared the International Year of the Nurse and the Midwife by the World Health Organization, who I still recognize and respect. And the reason is it's the 200th anniversary of her birth. So in 1820, she was born, and she lived until, I think, 1910, somewhere like that. This was the Smithsonian magazine 2 months ago, and it's really a remarkable piece on Florence Nightingale and how she really was, you know, kind of a revolutionary at her time. they have decided, the World Health Organization and the International Council of Nurses, that this is not a year for celebrations. We were supposed to have all kinds of big parties, and I was supposed to have a conference in San Francisco that, of course, we're not having. They're going to continue the celebration into next year. So, who would have known, though, how visible nurses would be this year? And what a turn of events, and what an opportunity to recognize the heroes of healthcare. And for my purposes, I'll highlight a few of the nurses. I don't know them personally, but these are just really positive images. This is a couple, husband and wife. They're nurse anesthetists. For those of you that know what a nurse anesthetist does, they do anesthesia, they do intubations. So these two are dressed for safety, and they're greeting each other with the hoods, the masks, the gloves, everything they could possibly wear. And let's just pray for them, that they're successful in this equipment serving as a barrier for them as they do their important work. It's a nurse image. A friend of mine sent this to me, a colleague in China. And this was just showing, and they were the first ones really to demonstrate some of the safety precautions necessary to prevent transmission. And a lot of healthcare workers in China have been affected as well. And just to show the effects of a mask on your face for 12 hours. And even that mask would not be sufficient, as we know now, for the coronavirus. It's not an N95, what we would call the better protective respirator. Well, enter the COVID virus. And aren't you glad I'm not using this as my virtual background, because it is pretty eerie. And it's just that new scary image of what we need to be aware of and afraid of. But there are things we can do about this. Quick global map, and you can see we're on regretfully bright blue. And we're beginning to see, that there are hotspots around the globe. And I think over 180 countries are dealing with COVID at this time. What the heck is it? What is coronavirus disease, COVID-19 as we're calling it? It's an infectious disease causing a new virus, and it appears to cause respiratory illness like the flu. However, it can also attack the GI system, the liver. We're finding that it has the potential to invade many other organs, and it can disguise itself in many ways. So it's not a black and white, clear-cut depiction, set of symptoms, or predictability. It's really very stealthy and scary. It's spread through contact with infected persons when they cough or sneeze. And we had a brief discussion before we went live here that unfortunately there's a period of time where people can be infected and not symptomatic and not know that they could perhaps be spreading the virus. That can then spread to individuals who touch surfaces or objects that have the virus on it, and then in turn touch their eyes, nose, or mouth. Good news, it doesn't penetrate intact skin, but it does penetrate what they now know, the nose, the eyes, the mouth. And if you've ever studied how often people touch their face, it's remarkable. And even if you think really hard about not doing it, it's almost impossible to not do it sometimes. And those of us with glasses or a runny nose from our jasmine out front, realize that we're often in contact with our face. And that's the most likely way that this is spread. This is actually, I pulled this off the Washington Post update today. In the US, COVID is rapidly becoming a leading cause of death in the United States. So I suspect by the time these numbers continue to grow, unfortunately, we may see it taking the lead. And we're finding, and what they're finding is that there are some cases, clearly cases of pneumonia and or heart disease that might indeed have been related to or a result of COVID-19. So there'll probably be some recalculation of some of the deaths. New York has just finished doing a little bit of that and realizing that people were misdiagnosed or just missed in terms because they weren't tested. And indeed, there was a likely COVID exposure. So from Florence to Dr. Fauci. So when Dr. Fauci speaks, we should all be listening. We should all be listening. And who is Anthony Fauci? He is what we're calling right now the nation's physician, though we do have a Surgeon General, and he's been doing a nice job. But Dr. Fauci is a director, has been a long-term director of the National Institutes of Allergies and Infectious Diseases. He's been a phenomenal person in the arena of infection control and disease prevention globally. He's well respected around the world, and he's been involved in some of the what we know are historical challenges: HIV and AIDS, some of the respiratory infections, SARS and MERS, diarrheal diseases, tuberculosis and malaria, as well as Ebola and Zika. So he has been either in the background or the forefront on a number of these really important um, challenges to health globally and locally. So he's advised 6 presidents on HIV and AIDS and many of the domestic and global health issues. And he helped put together some of the President's Emergency Plan, PEPFAR, a program that went international for AIDS relief around the globe. George Bush was actually given a great deal of credit for his commitment to this initiative and his support of it around the world. And he's still involved as a past president. So Dr. Fauci's early assessment was probably about as accurate as anyone could have come. And he said, when I looked at what was happening back in January, he's not the person who takes the limelight, nor does he try to grab the headlines, but he does grab some headlines because he's very frank in his conversations with the press, and he doesn't sugarcoat things. So he said, it was clear to me at the end of January that this could become a pandemic. And once it was transmitted from person to person, it became a whole new disease process called community spread. And it isn't just about traveling. It wasn't just who went to Wuhan or who was in Beijing or who was in northern Italy. This became an opportunity, unfortunately, for this virus to spread person to person. And many of the cases are people who live with others who have the disease, but some of them are not. And some of them are the random community spread, or the party that somebody has gone to, or the funeral that 2 families went to in Georgia, and dozens of individuals became infected. So at that point, he realized in January that we were in real trouble. And when Fauci speaks, we should listen. So here's the truth. Here's the fact about the coronavirus. At this time, there's no known treatment, there's little testing, and no vaccine. Now, we know that the flu will come back in the fall. It'll be a different version of the flu. We'll be overconfident that we can get a flu vaccine for those of us that do that, or that it won't kill us, which we should not be overconfident about. But there are a lot of flu treatments now, Tamiflu and others, that have found to be very effective in treating influenza. And so there's vaccines and there's treatment for influenza. And that's still a dramatic threat to our public health. This presents a whole new threat because until there's known treatment, there is experimental treatment, but it's not been proven yet. There is little testing and there is no vaccine at this time. This virus will continue to be out there as a threat to us. However, there are things we can do, right? But we are certain of this. And this is recommendations from Dr. Fauci, from our own public health director, Dr. Mace, who's I find very impressive. She's definitely an esteemed scientist, and she's keeping a close eye on our county. And she's been on top of these orders. So you can protect yourself by washing your hands, avoiding touching your face, and avoiding close contact. They consider that 6 feet with all people. Unless it's someone you're living with, then you should really be cautious. And so as of this Friday, as you know, masks are going to be required in Sonoma County and in any enclosed space. So the next time I go to the grocery store or when I go to the farmer's market on Saturday, and I might not be able to maintain a 6-foot distance, I will be wearing my mask. And I'm the designated shopper and caregiver for someone who is immune suppressed and has had cancer and can't do that for herself. So I'm very aware of my need to be safe and also to protect others in case I become ill. If you're ill, stay home, call your provider. Don't just show up at the emergency department or in a physician's office. You could be inadvertently bringing that illness with you. And we have to listen to our shelter-in-place orders by Governor Newsom and our public health director. And we work and live in San Francisco. Luckily, we have this wonderful home in Wickiup. But our mayor, city and county of San Francisco, moved even more quickly, and then immediately, the University of California, which has been very, I'd say, aggressive in their safety. They shut down our schools in the third week of March. We were told at that point, you will modify all of your courses and you will go online. It was the right thing to do. We couldn't get into classrooms, and have adequate distancing. And we realized that 50 people was too many, 10 people too many in a room. Let's just get out of the building and shelter in place. So that's really where we're at right now. But these are working. So I don't have the curve. I don't have any flattening to show you, but I think we've all heard about things like flattening the curve and trying to prevent as much as possible the emergencies that could be created if we put too much stress on any of our healthcare systems right now. So our Kaisers, our St. Joseph's, our Sutters are gearing up, have geared up. They have their testing tent in the parking lot. They are finally getting equipment for staff, and they have capacity. And so if we can keep the spread down and keep that surge, as they talk about, from happening, we will probably get through this spring and be on the other side of it. But there is a concern. I know our public health director thinks that our surge in this area could be a little bit later. And so she's actually talking about May and even early June. So we've got to work on that. When do we resume a new normal? Again, when asked, Dr. Fauci will say, it has to be only when we can identify, isolate, and contact trace. And that means a lot more testing, an awful lot more testing, and really give people an opportunity to isolate. So my next slide, I believe I talk about those who are having trouble isolating. The homeless, for example, are struggling with hand hygiene and hygiene of any kind and isolation. So this is really going to be the conditions on which we will return to some of our new normal, and parts of the country and the economy will be on a rolling basis. And I heard him the other day say, it is not going to be like a light switch. When we say, okay, it's June, it's July, it's 80 degrees, it must be gone now. And I think that the guidelines from Thursday, which will be the governors and the president working in concert, will clearly outline this kind of a strategy. I know Governor Newsom has this in mind for this state. And we're going to have significant periods of decline in cases, decline in hospitalizations, declines in deaths before anybody is going to feel confident that we've passed the threat. So who are we worried about now? I think we all have to be worried about anybody in a nursing home. And the New York Times earlier this week identified more than 2,500 nursing homes and other long-term care facilities with corona cases. Governor spoke about that. I believe it was Monday or Tuesday. The focus of his press conference was on nursing homes, assisted living, residential care facilities. So these numbers are probably a little old, and unfortunately, this is congregate living and individuals with underlying health problems, and older individuals are certainly at risk, but so are others with underlying health problems. And that's why we're seeing across the country minority communities with higher rates of illness and death. So pre-existing conditions, heart disease, lung disease, risk factors such as smoking and obesity, and some of those other realities are challenging the minority communities. But I just want to say something before that last bullet. The statistics are a bit alarming that it isn't just age over 65. for people that are experiencing illness and death. There are some young people, some with no pre-existing conditions at all, marathon runners and very, very active individuals who are becoming ill fairly quickly. And they think, because we don't know enough about this disease, this virus right now, that there may be some genetic influence there as well. So there will be a lot of lessons learned from spring of 2020. And last but not least on this slide, the other worry, and I mentioned it earlier about the homeless communities, those who are living in shelters, and certainly San Francisco has had a recent surge in shelter-related transmission. And they're talking again about really trying to increase the housing opportunities. And Sonoma County has had its share of homeless struggle with the Joe Rodota Trail and the temporary shelters, and the shelter I know very close to Oakmont. So if there's safety factors there to assure hygiene and distancing, it should be fine, but some cases that is not necessarily the case. And there are people with mental illness and drug substance abuse disorders who may not be able to actively participate in some of these strategies. So they're having a hard time, and they're going to present challenges to our public health officials. So I'm not going to be gloomy, because I'm not. So thank you for staying home. We're going to enjoy beautiful spring weather. You're going to drive to San Francisco again to go to a play, or maybe go to SFO for your next international flight, or wherever you want to go and visit people you want to visit and live our life. And we're going to visit the hills of Sonoma and look at the sunflowers and the poppies and the wineries and the redwoods and all of those great things that are out there in our own backyard. But we have to stay home right now and just look at pictures. So thank you for letting me join you today, and I look forward to our healthy Q&A session.
Mary, thank you very much. Dr. Foley will be back with us at 11 o'clock on Sunday morning for a Q&A session. If you aren't there already, you go to oakmontsundaysymposium.org/live, and the instruction will be there about how to get on the Q&A. And then if for some reason you don't do that, next week our speaker will be Dr. Hollis Robbins, who's the Dean of the School of Arts and Humanities at Sonoma State. And she's going to be talking about a fascinating historic case where a diary was discovered of the life of a slave in an attic. And she's going to talk about who that slave was and how they traced the identification of the diary. Well, thank you very much, Dr. Foley.
Thank you. Appreciate it very much. Look forward to our Sunday talk.